Hello, my name is Daniel Stillwell. I'm the editor of the IFTA e-newsletter, and we are in Spain at the IFTA conference, and we have with us today Jeff Chang. So
Hello.
we're going to talk about your work and your presentation,
Okay.
but let's just start off with what kind of mental health practitioner do you identify as, because it looks different in different places
Sure.
around the world, and what does that look like in your context?
Okay, so I'm a registered psychologist in
Mhm.
Alberta, the province of Alberta, Canada. In most of Canada, there is no MFT licensure,
Right.
and I've had the good fortune to be quite a few years ago working at a place where I could get supervised towards clinical membership and being an approved supervisor in AAMFT.
Okay.
So my identity, I've maintained an identity as an MFT while maintaining licensure as a psychologist.
Okay.
Yeah.
All right. Nice. So what kind of clients do you generally work with yourself?
Okay, so I've got a couple of non-academic gigs. So my day job is I'm a professor
Mm-hmm.
at Athabasca University, which is a distance university in Canada.
Okay.
And my clinical work, my direct practice, there's about three threads to it, I guess. One is I do a little bit of work at Calgary Family Therapy Center,
Mm-hmm.
which some of you may know was started by Dr. Carl Tom, and I'll just put in a plug. This year,
Yeah.
August 16th to 20th, we're celebrating the 50th anniversary. So Carl started it in 1973.
Mm.
He's still working hard at it. He turns 84 this year, and we're going to celebrate him and have a great conference. So August 16th to 20th, put it in your calendars.
There you go.
Okay, so I do a bit of work there.
Mm-hmm.
My private practice is primarily with high conflict divorcing folks, so I do child custody evaluations and other sorts of assessment related to
Wow. Yeah.
high conflict divorce, and I also do a little bit of therapy, but not quite so much.
Mm-hmm.
I do a chunk of clinical supervision for pre-licensed folks,
Nice.
and I do that in conjunction with my wife, who's also a psychologist. And I have a contract with a school, a special education school for students with neurodevelopmental disabilities and mental health problems.
Okay.
So I've got a fairly full plate.
Nice.
Yeah.
Yes. But a little diverse, so you're
Yeah.
not all focused on one thing. That's great. Okay. So you're here at the conference. You
Yes.
are giving a presentation.
Yes.
Tell us a little bit about it.
Okay, so the presentation comes out of some ideas that I developed in writing a course for my university employer.
Mm-hmm.
All the courses are written for online delivery, and there's asynchronous discussion. So there's a ton of text that goes into the course with connected learning activities. And this will be part of my presentation tomorrow. There's no licensure for MFTs in Canada. There's very little MFT training
Mm-hmm.
in Canada. Many of the people who practice what they call couples therapy or family therapy have very little training. And so this is the one family therapy course in a curriculum for a Master of Counseling program.
Okay.
So the focus of the course is taking people from individual counseling skills to towards introducing them to some family therapy skills.
Okay.
So those of you who may be viewing this may have been trained in a counseling program or a counseling psychology program, and you may have learned empathic responding skills,
Mm-hmm.
reflecting affect or reflecting content or reflecting meaning, and questions being defined as open or closed questions,
Right.
that kind of framework for learning counseling skills. So I'm taking that a bit further and building on that base because our students are already familiar with that way of thinking,
Mm-hmm.
right? So, so reflecting content, which is sort of the basic level of here's what you said,
Yes.
right? I'm extending that to relabel that or reappropriate it as reflecting shared content, Okay.
Yeah.
right? And reflecting affect, right? Would be reflecting coupled emotion or coupled
Mhm,
affect,
mhm.
right? When he does this, that leaves you feeling this way, right? And introducing the interpersonal element into that.
So not only the dynamic, but maybe also like the collective, like the vibe as well. Yeah. Okay.
Right. And then, for example, reflecting meaning would be reflecting shared meaning. I mean, and the other thing is sometimes those are not shared. So sometimes there's disjunct, like disagreement about content, disagreement about affect or different affect, disagreement about meaning, right? And then using the idea of open questions to push beyond that and to ask questions about the patterns that are involved as opposed to what one's individual experience is. Or open questions that link individual experience to the experience of another individual. So that's kind of what I'm doing, taking what counseling students who have done the vast majority of their skill practice with another graduate student, another individual graduate student, extending that into extending those skills into skills that more support a relational view, right? The other thing that's kind of, I think, in a sense, easy to teach, and I think about this as the smallest unit of systemic thinking, right, is the IPScope, as developed at Calgary Family Therapy Center. And so IP stands for interpersonal patterns.
Yes. And
there's all kinds of interpersonal patterns. The PIPs are pathologizing interpersonal patterns. So those lead to negative emotions and estrangement in relationships. Right? And there's wellness. There's WIPs that are wellness interpersonal patterns. So hopefully everybody out there has lots of those with their loved ones, where it's like supporting, feeling supported, or disclosing, listening. So these are coupled behaviors, right, between two actors, right, and there's HIPs that are healing interpersonal patterns. So those are antidotes or replacements for PIPs, right, and there's a bunch of other ones, right. So when we think things are going down the tube a little bit and we're walking on eggshells, those are dips, deteriorating interpersonal patterns. And as a therapist, if I ask about something that might push things in a different direction, that could be a tip, right? A transforming interpersonal pattern. So it's the easiest. It's quite easy for people to get that conceptually. There's lots of theories of family therapy, as we all know, and this is something that's quite easy for people to get a hold of, get their head around, because you can just ask them to observe it in their everyday interactions with their loved ones or workmates or whatever, right? So that's quite easy, and it's a way of thinking about it is that it's the smallest unit of systemic interaction, the dance that goes on between two people.
Yes.
So we can build lots on top of that, right? So people who are maybe inclined towards EFT, well, attachments get formed by recurrent interpersonal patterns, right? People who are interested in Gottman, that's all about teaching.
Yeah, very much.
Like catching, the Four Horsemen. Those are absolutely PIPs, and teaching. A more instructional approach to teaching WIPs, so that WIPs happen more often. Right. So it's an overlay on top of almost any other model that you could think of. But it's easy to teach, and so using those two things, right, or those three things, the responding or sort of empathic responding skills that we teach in individual counseling, the kinds of open questions, and helping students direct open questions to the pattern, the interactions, not the individual,
right,
and teaching PIPs so that they can, or the IPScope, so that they can recognize interpersonal patterns when they see them in a very simple way. That's kind of the basics that I try to do in the particular course that I wrote. The other piece is theory development, and we don't, we get people to dive into one theory and present and teach it to others. It's not a theory heavy course, like lots of family therapy courses would be like family therapy theory of the week,
Right.
right? And we don't do that, but we're trying to, it's part of a sequence in our curriculum of maybe 3 or 4 different courses in which they develop our students develop their theoretical thinking before they go out into practicum.
Mm-hmm.
So that's kind of it
Nice.
for the presentation, and it's basically an encapsulation of the course that I wrote.
Well, and I know one of the reasons why a lot of people like the IPScope is it does have that versatility to work with different people, different dynamics, different cultures even.
Yeah.
And so here we are at IFTA. Have you been able to talk to people about how this works in places outside of your own sphere?
At this particular conference?
Or in the past,
yeah.
I don't know.
Yeah. You know, I some colleagues from the CFTC and I wrote a paper on IPScope in supervision.
Ooh,
we presented it
yeah.
at IFTA, in Aberdeen, and then we contributed to the special issue that Mark Rivet and Bill Northey edited. So the context is in the context of supervision is really valuable in about 3 or 4 different ways. I've presented it in my work at this school that I have a contract with. I present it in the context of classroom management and interactions that school staff would have with parents. Right? So I think you could use it almost anywhere. I mean, I'm a bit surprised that nobody else has taken it forward that I've seen. I shouldn't say that nobody else has done it, but I just haven't seen it. Into workplace interactions, like workplace coaching and leadership.
Yeah, even basic conflict management type of things,
It comes in handy for me in terms of, as I said, my clinical work is largely in high conflict divorce. And it's really easy in those situations to get aligned with one person, right? So if I'm doing an evaluation, person A comes in and they seem like a very, like nice, reasonable person.
Sure.
And they portray the other person as kind of like the spawn of the devil. And then person B comes in and then they seem like a reasonable person and they portray the other person as spawn of the devil. And like, how could this be true?
Right.
If you didn't see things interpersonally, then it would be an irreconcilable, black and white situation.
Right.
But when I hear what person A says and when I hear what person B says, then I can actually imagine the pips that happened historically in their marriage, or the pips that happen currently in their co-parenting relationship. And you don't even have to be in the same room or the same country, the same location to engage in a PIP with somebody. Right? So it's been really handy for me, and in my teaching therapists about high conflict divorce, doing therapy. I mean, I mostly do evaluations, but I've been teaching a bit about doing therapy with high conflict divorcing families. And because seeing things in interpersonal patterns is really helpful to not become aligned with one party in the divorce more than the other.
Right.
That still doesn't mean to say that sometimes people, one person in a couple or in a marriage or in a co-parenting situation, their behavior is more egregious than the other person in a fairly clear way. But so there's still sometimes that people behave, one individual behaves quite badly, so to speak.
Sure.
But seeing things in interpersonal patterns is really helpful to as a practitioner to help me be less blameful, to help me be less aligned, and perhaps less biased with respect to any work that I do, whether it's evaluation or therapy. A lot of professional complaints against MFTs, psychologists, counselors, what have you, arise as a result of being too aligned with one party in a high conflict divorce. And that's the area of practice that seems to draw the most complaints with regulatory bodies.
Right. Yeah, and I mean, even as systems thinkers, we want to be aligned with the system, but when the system is trying to destroy itself, that creates ethical quandaries
Mhm.
that normal people, especially if they're not especially well trained in some of this, are likely to fall in some of these holes.
Yeah.
So I'm glad that you're pointing that out.
Yeah. And if we get drawn into thinking that one person is trying to destroy the system,
Yes.
that's absolutely
Mhm.
that's where everybody's toast.
Yes.
Right. As a practitioner, you're handcuffed. Whatever you're doing,
Mhm.
as a and if the individual parents, the ex-partners get into a view of one person, the other person is nothing but bad.
Mhm.
That's what just makes these conflicts so just so terrible for
Yeah.
kids.
Absolutely.
Yeah.
Well, thank you for telling me about this, or
You're
telling
welcome.
us about this. This is, again, I love how versatile the process is, and being able to have a framework that can ground you in a systems perspective, almost no matter what the situation is a really valuable resource.
Cool.
Let's end with something a little fun.
Okay.
So you're from Canada.
Yep.
You're in Spain, so you're in Europe. Where in Europe would you go if you had no concerns about money?
Oh boy.
Expense. No expense.
I'd probably do Italy, but do it really well.
Oh, okay. Like
Yeah.
where?
All over. Well, I'm just watching this show on CNN with Stanley Tucci.
Mm-hmm.
And
Mm-hmm.
so he ate his way through like 20 different regions of Italy. So,
Right.
That'd
That'd be a fun tour for you.
that would be absolutely
That's awesome.
cool. Yeah.
All right.
Yeah.
Well, thank you so
Thanks.
much for sharing this,
Thank you,
Jeff
Dave.
Chang, and we'll be seeing you around.
Okay.